not have heard much about hip dislocation, but football fans probably remember the Crimson Tide's C.J. Mosley going down with that injury in the BCS game. Today in Healthy Living, we're going to tell you all about hip location and show you how to treat it. Take a look. Not only am I extra fashionable today, but we have a really exciting Healthy Living segment for you this morning. This is Dr. Clayton Lane with Alabama Orthopedic Clinic. Good morning.
Good morning.
Good to see you again.
Good to see you.
We're talking about something that is really timely as well because we just had the big BCS National Championship football game. C.J. Mosley from Theodore went down with a hip dislocation. And we're going to talk about that injury today. First off, Dr. Lane, is this a very common injury?
It's actually very rare in athletics. The reason is that the hip joint is a deep ball and socket joint, unlike many other joints in the body. So for an athlete to dislocate the hip, it really has to be in a very contorted position, internally rotated, in order to slide out the back. There's also very big muscles and ligaments around the hip that make it very stable. It's actually more common to see in a motor vehicle accident and higher energy injuries than athletics. When you have a hip dislocation, does it always require surgery? It doesn't always require surgery. Basically, after we put the hip back in place, we'll get further workup, such as an MRI or a CAT scan. And if there's a little piece of cartilage broken off or the labrum's torn or ligament, then sometimes it will require surgery. All right, and you have that demonstrated for us here, and we have this all set up ready to go here. What are you going to show us? Well, I'm going to show you 10 to 15 years ago, this kind of thing was catastrophic. It involved major incisions in the hip, like what you'd see for a hip replacement. Obviously, that's not going to go very well for a competitive athlete. But now, with the advent of arthroscopy of the hip, we're able to do the same type surgeries through small, maybe 2 to 3 incisions, about the size of your little fingernail. All right, let's take a look. Okay, so this is an anatomic model of the hip that we actually had flown in from Boston for you. Wow. But it's a gross anatomy. It doesn't show all the nerves or blood vessels that you would see in the hip, but you can see grossly the muscles that are involved here. Also, you see it's positioned on a special hip arthroscopy table. That's so we can bring in x-ray, live x-ray, while I'm doing the procedure, so I can see an x-ray image as well as a video image of what we're doing. That is awesome. X-ray and video image. Pretty cool. Correct. So what we have here is an arthroscopy camera. It's 70 degrees angled, and what that means is I can rotate the lens and see 360 degrees all around me in a very tight spot. Okay. So I've already established a cannula here into the hip joint as what we would do in surgery, and then we just slide the camera into the joint. So that's the labrum of the hip, and obviously this is a plastic model, so it's not totally anatomic. But in a hip dislocation, that would be torn, and we would use special instruments through this separate port. Here, I'll have you hold this. Sure. And then we can bring in instruments such as this, which also are very good for working in tight spaces. I'll bring this into the field. Let's see if we can see it. So we slide an instrument in such as this, and you can see that just by pulling the trigger, I can move the instrument around within this very tight space. And this happens to be an electric cautery, which I'll use to stop minimal bleeding and clean up the edge of the labrum. All right, so Dr. Lane, as we continue our surgery here, we're talking about C.J. Mosley. What's the rehab/prognosis for him? So depending on whether or not he has surgery, he's obviously going to have a bearing. But in most cases, it's just immobilization for a couple of days, then protected weight bearing and range of motion for about 6 weeks, and then after that, they'll advance as tolerated. And what am I doing here? Here you are attempting to repair the labrum that's been torn in the posterior dislocation with a bioabsorbable anchor and stitches. Do you think I have a career in the medical field? You do. You're all there. Look at this. We've got it going here at the Alabama Orthopedic Clinic, and of course, if you have any questions, you can feel free to give Dr. Clayton Lane and his peers a call right here. Thank you so much for joining us. You're welcome. Thank you. I can't shake your hand because I'm back to surgery. This is very serious. This is very important stuff.